Rachel, I know one of the concerns many people have about chemotherapy are the difficulties that they might have with nausea and vomiting. And I think we've made significant strides in that area in the last several years. I wonder if you could expand on that.
Any of the majority of the chemotherapy agents can cause some nausea and vomiting. I think we are very, very proactive now as far as the medicines we give people. We will give them prescriptions ahead of time, to take, and we'll give them specific instructions on how to take the medicines. We recommend people actually continue their normal meal schedule, although make it more light. They will do better tolerating cool foods and things that are a little bit more lighter, kind of keeping something in your stomach at all times. If you try and do heavy meals, you get more of that bloating feeling, which can also add to your nausea. I think people overall have a stereotype of with chemotherapy that you think it's going to be awful and you're going to have a lot of nausea, a lot of vomiting. Yeah, you're going to have some nausea, but we do control it very, very well. Number one thing we want to do is make sure that you stay hydrated. If you are nauseated, you got to make sure you still try and push those fluids because you can get dehydrated very easily. We want to make sure we stay on top of that. If for some reason you're not able to keep fluids down due to your nausea, give us a call. We can always address that issue. Also, we can adjust your meds. If we've given you the prescriptions and you say, well, I'm still having this nausea, then we can do something about it. Just because we gave you one drug doesn't mean there's something we can't do to address that situation.
And Rachel, one of the things I think we often see are people who might be misinterpreting reflux and gastritis, heartburn in other words, as nausea. Would you care to comment on that?
Yeah, that's true. A lot of people aren't familiar with a lot of the feelings they get with the chemotherapy. If they do tend to get a little bit of reflux, we recommend you can take either Pepcid over the counter or Prilosec or something to that nature to deal with the reflux, because a lot of times if you do have that, that's going to add to your nausea issue.
Mm-hmm. I've also often see those patients, for example, state that if I eat food, I feel a little better, and that's of course because the food is neutralizing some of the acid in their stomach, and so that's often a clue, I think, that patients may be having more symptoms of gastritis or reflux than actual nausea.
I agree.
When do patients usually experience nausea in relation to their chemotherapy? I
think it varies a little bit depending on the drug they get. But usually about maybe 3 to 4 days is probably their period where you got to kind of get them over that hump. Some people, everybody's a little different, so not sure how they're all going to respond to it. But some people, it may hang on for, day 4, day 5. Some do great, and just is tolerated quite well.
And many people have no nausea, as you just mentioned.
Mm-hmm.
What about in terms of the things that we do medically in order to try to prevent their chemotherapy, either before the chemotherapy intravenously or orally afterwards?
As far as?
Medications, delivering medications.
Well, they'll actually get some pre-meds when they get their chemotherapy IV when they're here with us. We give them a whole instructions ahead of time as far as how to take the drugs that we give them. We give them some PO medications to take at home. So we'll tell them, when to start taking the ones depending on their chemotherapy and what drugs they get here. We'll tell them how to take it day 3 or day 4 or when to start taking certain ones. Also give them some medicine to help them sleep at night, because some of the medicines we give them during their chemo tend to keep them awake. So we'll give them some things that will help them, sleep, and some things that may cause some drowsiness. So that way they can kind of get over that hump a little easier also.
And you mentioned liquids. I think one of the misconceptions patients have is they have to eat solid food. And there may be more challenging days where, as you said, dehydration is really the enemy we're trying to fight. And perhaps just focusing on liquids those days, and especially nutritious liquids, if they can handle things like Carnation Instant Breakfast, Ensure, or milkshakes, or in the worst case, even things like Gatorade or water, just to stay hydrated is good, especially if you expect that nausea to pass relatively quickly within a day or two. Well, Rachel, I know we're also focusing on dehydration and how much is enough if you're being challenged by nausea and you're trying to get in enough fluid. What would you counsel people in terms of the amount of fluid they should be taking?
I would tell them at least to take a liter minimum. 1 liter to 2 liters is great. When we say a liter, like if you think of one of those soda bottles, like the Pepsi, the Coke, that's a liter bottle. So if you kind of focus on that, even if you fill that up with water and keep it, in your refrigerator, so you kind of know what you need to drink, just kind of as a benchmark that, okay, I won't drink half this bottle, now I need to drink the rest before the day's over.
Great. And so dehydration, which is what we're worried about, can you talk about some of the symptoms someone might have with dehydration?
Some people become lightheaded, dizzy, just a lot of fatigue. Some people just, a lot of times their blood pressure is lower, so they just overall do not feel well. Not urinating a lot, just a lot of dryness in your mouth. Those are just kind of some of the classics.
And they'll often have more of a dark concentrated urine too also.